It also lowers systemic inflammation by modulating cytokine profiles and enhances mitochondrial biogenesis through the activation of PGC1-alpha, a key regulator of energy metabolism and cellular adaptation. Over time, the cumulative benefits of Zone 2 training manifest in improved physical stamina, emotional balance, and overall health span. An extended period of life spent in good health, free from chronic disease. Unlike high-intensity workouts that impose substantial stress on the body and nervous system, Zone 2 work can be performed frequently without compromising recovery, making it sustainable for individuals across all age groups and fitness levels. It builds the aerobic foundation upon which all other forms of fitness can be layered, providing the physiological resilience required for both athletic performance and long-term vitality. In essence, Zone 2 training represents the sweet spot of exercise physiology, a scientifically grounded, medically validated, and highly sustainable form of training that nurtures the body's core systems. Through enhanced mitochondrial function, improved cardiovascular efficiency, balanced metabolic regulation, and superior energy utilization, it stands as one of the most potent lifestyle interventions available for optimizing both health and longevity. Anal intercourse, from a medical perspective, involves the anus and rectum, areas of the body that are delicate and not naturally designed for penetration, making them particularly prone to microtears, tissue damage, and bleeding, which significantly increases the risk of transmitting sexually transmitted infections such as HIV, hepatitis B and C, gonorrhea, chlamydia, and other bacterial infections, while also potentially causing temporary pain, soreness, and in repeated cases, longer-term complications. Because the anal canal lacks the natural lubrication found in the vaginal canal, friction during intercourse can exacerbate tissue injury, highlighting the importance of proper protective measures and precautions, as medical research clearly indicates that there are no inherent physical health benefits to anal intercourse, though some adults may engage in it for psychological or relational reasons, including intimacy, trust, and emotional closeness within a consensual relationship, emphasizing that consent, comfort, and open communication are critical factors for both mental and physical well-being. To reduce the medical risks associated with anal intercourse, healthcare organizations such as the World Health Organization, WHO, and Centers for Disease Control and Prevention, CDC, recommend several key safety strategies, including consistent and correct use of condoms to significantly reduce the transmission of STIs, the use of water-based or silicone-based lubricants to minimize friction and prevent tissue damage, thorough hygiene practices before and after sexual activity to prevent bacterial transfer and urinary tract infections, and routine medical checkups and STI screenings, particularly for individuals with multiple partners or those engaging in high-risk behaviors, with emphasis on the necessity of changing condoms and cleaning thoroughly when switching between anal and vaginal intercourse to avoid bacterial contamination and infection, while also ensuring that any pain, bleeding, unusual discharge, or persistent discomfort is promptly evaluated by a qualified healthcare professional, as early detection and treatment of infections or injuries are essential for preventing long-term complications. Beyond the strictly medical perspective, it is important to understand the psychological and relational context in which adults may choose to engage in anal intercourse, as some report benefits such as enhanced intimacy, mutual trust, and sexual variety in their relationships, though these perceived advantages do not mitigate the physical risks, making informed consent, clear communication, and mutual agreement indispensable elements of safe sexual behavior. Medical and public health guidance further stresses that individuals must be educated about the potential hazards, be equipped with protective measures, and have access to accurate sexual health information in order to make informed decisions. Globally, research indicates that the prevalence of anal intercourse varies widely across regions, with surveys showing that roughly 30 to 40% of adults in North America and Europe have engaged in it at least once in their lifetime, while reported rates in parts of Asia, South America, and Africa are lower, generally ranging from 10 to 25%, though these figures are likely underestimates due to cultural taboos, social stigma, and reluctance to disclose such behaviors, highlighting that societal norms and reporting practices influence prevalence data more than any biological predisposition, and emphasizing that public health initiatives should focus on education, harm reduction, and safe practice, rather than moral judgment. Common misconceptions about anal intercourse include the belief that it can prevent pregnancy, that it is inherently safe without protective measures, or that only certain age groups or demographics engage in it, all of which are false. In reality, anal intercourse carries specific medical risks regardless of age, gender, or sexual orientation, and protection, hygiene, and medical awareness remain critical for everyone. Public health authorities, including WHO and CDC, consistently emphasize the importance of awareness campaigns, sexual health education, and non-judgmental guidance to ensure that adults can make informed, safe, and consensual decisions regarding anal intercourse, while also encouraging routine STI testing, vaccination where appropriate, and the maintenance of open communication with sexual partners. Adhering to these guidelines, using condoms and lubricants, practicing proper hygiene, and responding promptly to any signs of infection or injury are essential steps in minimizing health risks and maintaining overall sexual and relational well-being. In conclusion, while some adults may engage in anal intercourse for emotional closeness or sexual variety, the medical evidence clearly identifies the potential harms, including tissue injury, infection, and discomfort, which can be mitigated through proper safety measures, consent, hygiene, and routine medical care, underscoring the fact that informed, consensual, and protected sexual behavior is the cornerstone of maintaining both physical and psychological health, while public health data and global surveys provide context for understanding the prevalence and social dynamics of this behavior, and highlight the critical role of education and preventive strategies in promoting safe sexual practices worldwide.